According to LASIKprocedures.wordpress.com, approximately 700,000 LASIK procedures are performed each year, making it one of the most common surgeries in the United States. And about 90% of the patients who receive the surgery achieve 20/20 to 20/40 vision, making them able to perform daily activities without the need for contact lenses or glasses. LASIK surgery is a complex procedure used to correct poor vision, and it has many benefits as well as some potential risks to consider. Due to the research that I have done as a result of my poor vision, I will be able to provide knowledgeable information on the procedure. In this speech, I will attempt to better inform you so that you will be able to determine if the procedure is right for you. I will begin by giving a brief overview on the procedure and describing how it is performed. Then I'll give some examples as to why the procedure is beneficial, and to end, I will introduce you to some of the potential risks to consider before having the procedure done. Now that I have provided a brief explanation of what is to come, I will give you a brief overview of the procedure and how it is performed. LASIK surgery corrects multiple forms of poor vision. It is a refractive surgery, meaning that it improves the refractive state of the eye. A laser cuts the corneal tissue of the eye, which makes it easier for the eye to focus light on the back of the retina. This specifically improves nearsightedness, farsightedness, and even astigmatism. Here you can see an ophthalmologist actually performing the procedure on a patient. And here is a simple depiction of what is going on in the procedure. And there are a few key steps involved in correcting vision by means of LASIK surgery. To begin, a few drops of topical anesthetic are dropped into the eye. Then, an eyelid holder is placed in between the eyelids to keep the eye open, which prevents the patient from blinking. Then, the ophthalmologist cuts the corneal flap open and leaves it up so he can remove a specific amount of corneal tissue from the eye. After that, the corneal flap is laid back over where it heals in place. Now that you are more familiar with LASIK surgery, I'll introduce you to some of the benefits of the procedure. There are several reasons as to why LASIK surgery could be right for you. For one, vision is corrected almost immediately after the procedure is done. It is associated with very little pain, and I know you might be thinking, they're cutting your eyeball open, which sounds really painful, I know. But because of the topical anesthetic that is applied to the eye, the patients really feel nothing. Recovery is also very quick. Typically for most patients, the eye heals completely after only about a few months. And to me, the most obvious reason as to why this procedure is beneficial is because it enables the patients to live their life without the need for contact lenses or glasses. And although there are many benefits to LASIK surgery, there are also several potential risks associated with the procedure. Some of these potential complications should not be overlooked, although they are very uncommon. They include issues with the corneal flap healing properly, dry eyes, light sensitivity, trouble seeing at night, undercorrection and overcorrection, and in very, very rare cases, the patients may have vision loss. And here you can see an example of an eye that did not heal properly. It is a little cloudy, as you can see in the cornea, and there's also a lot of redness in the eye. So this patient will probably have to go back to the ophthalmologist and have some more procedures done. In conclusion, I hope you now have a greater knowledge about LASIK surgery. LASIK surgery is a complex procedure used to correct poor vision, and it has many benefits as well as some potential risks to consider. I've given you a brief overview of LASIK surgery and have shared with you some of the benefits and risks associated with the procedure. It is an effective and painless procedure that gives you the opportunity to live your life without glasses or contact lenses. But there are some potential risks that should not be overlooked when having the procedure done. They include healing issues and some additional vision problems. But if you're tired of getting up out of bed in the morning and looking around for your glasses, or getting up to stick a piece of plastic in your eye, LASIK surgery might be for you.